Thank you, Andy, and again, thank you those of you from the media for joining us. We truly appreciate you getting our message out. As typical, I will share some numbers with you and then some opening remarks, and then we'll get to our questions. As of this morning, Northern Light Health is taking care of 81 individuals who are inpatients across our system with symptoms of COVID-19. 11 of those are at A.R. Gould Hospital, 37 at Eastern Maine Medical Center, 6 at Inland Hospital, 5 at Maine Coast Hospital, 4 at Mayo Hospital, 12 at Mercy Hospital, and 6 at Sebasticook Valley Hospital. We also have 14 patients who are being treated at home by our home care and hospice team. Our 2-week positivity rate for COVID-19 is 18.59%, with a 1-week positivity rate of 17.75%. Remember that means that the total number of tests that are positive divided by all the tests that are run at Northern Light Health facilities. We also have available our most recent COVID-19 hospital graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalizations and severe illness. As we noted before, this graphic represents a snapshot in time, and the data is changing constantly. The graphic, which included data compiled from this morning, will be shared in the chat. It has been 1 year and 1 day since we received our first shipment of vaccine from the state of Maine. I think we all hoped we would be in a better place in terms of infection rates and hospitalizations, but let's not forget how far we have come in a year. Today we have 3 different types of vaccines to protect us against COVID-19 and promising treatments under development that all have been proved to reduce the likelihood of severe disease and death. To date, Northern Light Health has vaccinated nearly 340,000 people across the state, and that now includes individuals 5 to 11 years of age. We have now vaccinated about 8,000 individuals in that age group. We are also ramping up efforts to provide booster doses. We know that boosters are critical to slow the spread of COVID-19, especially as we are now well into the holiday season. To accommodate the high demand for COVID-19 vaccine boosters, Northern Light Health is hosting a series of vaccine clinics at Northern Light Health Center at 885 Union Street in Bangor. We held our first clinic on Monday from 2 to 6 p.m., and I am pleased to report that we administered 132 booster doses out of the 138 individuals scheduled. Our next clinic will be held tomorrow. These are not walk-in clinics, and people do need to make appointments. Online registration for booster vaccines is available on our website at covid.northernlight.org. Eligible community members may schedule a booster appointment using the scheduling tool. If they do not have access to a smartphone or a computer, they should call 207-204-8551 to make an appointment. Northern Light Home Care and Hospice has temporarily reopened its vaccination site at the Main Mall in South Portland from December 14th through December 22nd. All brands of COVID-19 vaccine are being offered. All eligible ages can be vaccinated, and at this clinic, no appointment is needed. Yesterday, the site administered 1,080 vaccinations. Regular vaccine clinic hours are from 1 to 7 p.m. There will be extended hours on Friday, December 17th and Saturday, December 18th from 9 a.m. to 6 p.m. and Saturday, December 19th, noon to 5 p.m. The site will be closed on Sunday, December 12th. As many of you know, staffing is an ongoing challenge for us and other healthcare systems across Maine. To assist hospitals across the state as we see a sustained high numbers of COVID hospitalizations, Governor Mills last week activated up to 75 members of the Maine National Guard. Those Guard members will provide assistance in areas such as entrance area health screening, food service delivery, patient transport, and other critical support roles. The Guard members deployed to Northern Light Health facilities will assist in non-clinical roles at our monoclonal antibody clinics. We will have 3 Guard members at Eastern Maine Medical Center, 1 at Mercy Hospital, and 1 at Inland Hospital. We thank Governor Mills and her administration for providing these additional resources. And with that, I will open it up for questions.
All right, thank you, Dr. Jarvis. We'll start with WABI. Allegra, you should be able to unmute now and ask your question.
Great, thanks so much. We have been hearing from several viewers and even just people within our own station that finding those at-home test kits has become very difficult, and just getting COVID tests in general as we sort of think about people heading home for the holidays. What would you recommend to people within our communities do if they are having trouble finding a COVID test, and is that something you're all seeing on your end as well?
Yeah, it's a great question, Allegra. And yes, we are seeing the same thing. We know that there are some other states where it is more readily available for people to get at-home testing done. Unfortunately, in the state of Maine, the supplies are very limited. And not only does it affect the general population of being able to do that, but it also does affect us in the healthcare because we rely on some of those similar tests in order to keep our workforce going. So, what I say is really people are going to unfortunately have to kind of call around and find places that are able to do testing in a timely fashion. Certainly, as you know, Northern Light Health has stepped up its ability to do testing, reopening several of our larger swabbing sites, including the one at the Bangor Airport, in order to facilitate the needs. But we continue to see an increased demand and the need for testing for many different reasons, but most importantly because of the high rate of spread happening in our communities now, and people need to know whether they are ill or not and whether they are infected with the virus. And so we know that testing will continue. We also know that the state of Maine is doing everything they can to ramp up their testing, but of course they're limited in supplies just like we are.
Great, thank you so much.
Did you have a follow-up, Allegra, or no?
No, that's it. Thank you.
Okay.
Thanks, Allegra.
Next, we'll move on to hymns. Susan Morris, you should be able to unmute now.
Yeah, hi. Thanks for holding this call. What I'm wondering is, what is it like at the hospitals there? We're a national publication, so just wondering what it's like in Maine at the hospitals. Are you running out of ICU beds? Is it like Massachusetts, where there are orders now in place to cancel elective surgeries? I'm just wondering how it is now as far as the surge compared to what it was perhaps last year when the pandemic first got started.
So it's a great question. So really comparing now and a year ago, beds are certainly more tight as they are right now compared to a year ago. And that's simply because of more widespread disease. Those of you who have been on this briefing before and certainly during this entire time know that at one point, Eastern Maine Medical Center certainly had a significant more patients who were positive for COVID-19. But our other hospitals had significantly less. We are now able to take care of many more patients in our smaller hospitals, which is good news, keeping people closer to home. But overall, the sheer number of patients that we see across the state is overwhelming our system. We are not in the crisis situation that we've seen on television in other areas where hospitals are boarding patients in hallways and in cafeterias and the like. We have not gotten to that point. But we are at a premium for things like critical care beds. It is quite often that there are extremely few critical care beds, particularly at the 4 major medical centers, including Eastern Maine Medical Center here in Bangor. And when that happens, it has a downstream effect. It means that people who present to smaller hospitals who are not equipped to take care of patients for intensive care for long periods of time no longer have the relief valve of being able to send those patients to a higher level of care where they would receive the care that's needed at the time. And that means those patients are boarding in our emergency departments. Similarly, we know that we have to cancel certain non-urgent procedures or postpone them for a period of time, meaning while for that particular individual, that's a delay in care that they most certainly need. Even somebody who's coming in for a hip replacement who's being told that needs to be delayed, that may cost them some time at work, that may cost them some ability to function out in our communities. So once again, this is another time for us to plead with our communities to help us out in healthcare. The best ways you can do that is to limit your opportunities to get sick from COVID-19 so that you are less likely to be admitted to our hospitals, so that we can stay open to take care of people who are having heart attacks, people who have been in motor vehicle accidents, women who need to safely deliver their babies in a hospital. To do that, we need everyone to get vaccinated. If you haven't started your primary series, please do so. If you haven't gotten boosted and you're eligible for your booster shot, please do that as well. Wear your mask when you're out in public, particularly indoors. Wash your hands frequently, and please stay home when you're ill. So thank you for giving me the opportunity to go through all of those important factors again.
May I ask a follow-up to that, Dr. Jarvis?
Please do.
I'm wondering, you talked about having a certain number of people being cared for at home, both through home health at home and a hospice team. Was this at-home care started for acute care patients? Was it started because of COVID? Or
No.
has this program been in place?
No, Northern Light Health has been able to provide home care and hospice services at home for quite some time. I will say that they are remarkable people, and every time the state of Maine has asked them to step up and play another role in our COVID pandemic, they have answered that call. And they do that too now. We have individuals who normally would be discharged to go to a skilled nursing facility who they have been able to remarkably take those patients home and care for them there so that they can recuperate at home rather than in one of our acute care places. They continue every day to amaze me at their capacity and their willingness to help everybody in our communities. But the problem is they're limited as well in staffing. And once we make it so that they can't do their jobs anymore, then again, that's going to be limited services. So once again, anything people can do to stay well, stay healthy, stay out of our hospitals would be appreciated.
Thanks, Susan, for your questions. Next, we'll go to Portland Press Herald. Eric, you should be able to unmute now.
Thank you, Andy, and thank you, Dr. Jarvis. I had two questions. The first question I have is, you guys have opened up some vaccine clinics, both in Bangor and down here in South Portland. The one in South Portland did really, really well yesterday, and it sounds like it's probably going to be gearing up for an additional increased demand the rest of the week, which is great. Are you seeing mostly boosters at this point? Are you seeing some younger people? Is it a mix? Where do you see most of the demand?
Yeah, so it's a mix. I will say that most of the individuals coming through were for booster shots, but at both locations we did do primary series, which is great, and we did see some kids coming in, and that is also wonderful. And so again, we want to make it so that our mission has always been, and we've always said, that as long as there is a Mainer who wants to be vaccinated, we will find a way to do so, and we will continue to do vaccinations as long as that demand is there. And so these two new clinics help us in that endeavor. Remember, you can still get vaccinations at a Northern Light retail pharmacy as well as at primary care offices. This is just another avenue, in particularly our larger population settings, so that we can get as many people vaccinated as possible.
Okay. The second question I have is, I don't know if you have seen any impact of the ability to treat COVID patients with whether it's monoclonal antibodies or other types of treatments within healthcare settings. Have you seen any impact of that alleviating pressure on the hospital, or is that something you're still hopeful could happen?
No, I think that our monoclonal antibody programs, not just at Northern Light Health, but at other health systems across the state and other hospitals across the state, has done a tremendous service to us all. One, it helps those people to get better sooner and keeps them out of the hospital. But then again, downstream effect. If that keeps one person out of the hospital, that's another bed that's available for some other condition. And so yes, we are very proud of what's happened here in Maine. We wish that we could administer more monoclonal antibodies, but again, in this case, we're hampered by both supply and staffing concerns. We're doing the best that we can to make sure that those who are most at need, we do have a list of how we go through to determine who's eligible for monoclonal antibodies, and I'm happy to say that our proactive approach at Northern Light Health of actually looking through all positive tests and seeing if it would be indicated for a person to get monoclonal antibodies, we've been able to accommodate almost everybody that's at high risk for severe disease in that program who wants to get monoclonal antibodies, and we know for a fact that has saved lives.
Thank you, Eric, for your questions. Next, we'll go to Spectrum News Maine. Susan, you should be able to unmute now and ask your question. Susan? All right, Susan, if you do have questions, just let me know in the chat and we'll make sure to unmute you again, or we'll get those over to Dr. Jarvis. We'll move on to WMTW. Talia, you should be able to unmute now.
Hello, everyone. Hello, Dr. Jarvis.
Hello, Talia.
So I'm also curious about the clinics. I was at the clinic in South Portland yesterday at the mall, Pier 1. And just wondering, because our viewers are telling us they're having a really hard time getting their vaccine at local pharmacies like Walgreens or CVS. And since the crowds were so large, I know Cumberland County is one of the most vaccinated counties in the state, if not the most. But were you seeing that these visitors were traveling from, say, an hour away? Were they traveling from far distances, or were these mostly people from the area?
Yeah, so again, it was a mix of individuals, and so, but we are aware that people did have to travel in order to get to there because they could not find a reasonable location to receive a booster vaccine or a reasonable date. I did hear stories of people that made appointments, but those appointments were either two or 3 weeks out or were canceled at the last minute. And so again, it's one of the reasons why we have started these 2 new clinics in order to facilitate ease for people to be able to get their booster shot or their primary series of the vaccine.
Thank you.
Thanks, Talia. Next, we'll move on to New Center, Maine. Stephen Armstrong, you should be able to unmute now.
Hi, Dr. Jarvis. Chris Costa's off, so you're going to have to make do with me this week instead.
Oh, no worries at all.
So I was curious just about where we're at a stage now where the Pfizer and Merck both have COVID pills that they're working on, and we kind of be looking at maybe a community treatment option for the first time might be coming through in the coming weeks. Up to this point, it's all been hospital-based treatment. What's your thought process with that so far? Has there been any planning or thought process of how that would look? Obviously, it's different than a hospital-based treatment. What would that do for you if something like that was available, and how would you kind of approach that stage?
Yeah, so we're excited about those developments. Unfortunately, it looks like the Merck product, its efficacy is not as great as we would like, and certainly not as good as monoclonal antibodies, which again, you're right, needs to be administered in a setting where a clinical nurse is able to either start an IV or do an injection. So an oral pill would certainly be a benefit. We know that initially volumes will be low regardless of when approval occurs. And so the state has started to talk about distribution processes. We were actually far along in that process, expecting that Merck would have gotten FDA approval last week or this week. That did not come because they are reviewing some more data. It looks like Pfizer's product will be a little bit more hopeful, but that's not going to be available probably until the first of the year. And I want to remind people, sitting around and waiting for a treatment is not the best way to protect yourself or to limit the problems that we're having here in the pandemic. The best way is to prevent disease in the first place and not rely on the fact that there may be something coming down the pike that can be helpful for us. And so, again, it just gets back to those basic principles. Get vaccinated, avoid large crowds, wear a mask when you're indoors in a public place, wash your hands, stay home when you're ill.
Stephen, did you have a follow-up question?
Yeah, and I guess just kind of just a quick follow-up on the National Guard numbers. You mentioned the numbers that are coming to each hospital, each region. When you receive a National Guard member who can assist you with like the monoclonal antibodies and those kind of services, is that a direct kind of translation of that Guard member basically frees up one staff member of yours to then work in ICU or various other places?
Yeah, so again, they're going to come in. These individuals from the National Guard are non-clinical roles, and as we've spoken about before, if the Guard was to activate, individuals who could play a clinical role, all they'd be doing is taking a hospital personnel, putting them in uniform, and then putting them back in the hospital. So that doesn't do anything to assist us in that regard. And so having Guard members that can assist in non-clinical roles, though, do free up, because we do have some clinical personnel who are doing some non-clinical roles right now because those roles have to be accomplished, and we can only do with what we have on hand. So anything would be helpful. And so yes, this could cause, allow for 2 things to occur. 1, put a clinical person back in a clinical role, or 2, just give them the necessary respite that they need. Our doctors, nurses, and support staff have been working tirelessly now for almost 2 straight years, and things are not better. It is, in fact, in some ways, it's a lot harder, especially when we have to tell a family that we have to cancel or postpone a non-urgent surgery, or worse yet, tell a family that, yes, your family member needs to be in a higher level of care, but there are no ICU beds in all of New England that we can transfer them to, so we're just going to do the best we can with what we have. Our small hospitals are amazing. The doctors and nurses there are taking great care of these people, but they shouldn't have to do that. And so that's really where we are. And so if we can provide just a bit of respite care for any of our staff, that's a welcome thing for us. And again, we applaud the governor for assisting us in that endeavor.
Thanks, Stephen, for your questions. Next up, we have Maine Public. Patty, you should be able to unmute now.
Thanks very much. I also have a question about the National Guard. Dr. Jarvis, can you tell us a little bit more about have the National Guard members been able to help you free up capacity, bed capacity at hospitals yet? Or right now, is it more, are they helping with the respite that you just talked about?
Yeah, so again, Northern Light Health has not had any direct members of the Guard report to us yet. We are expecting them shortly, and we will have to do some training to get them set up so that they can assist us in a safe manner and an effective manner. Around the state, we do know that the National Guard has helped to free up beds simply because they've been helping in some skilled nursing facilities to open beds there so we can decompress our hospitals by having those patients that no longer need to be in an acute care facility but are not yet ready to go home. The more that happens, the more that's helpful to us. But at the same time, we have our own staffing concerns that we need to address, and this helps us to address that in a small way, but in a positive way.
Okay, thanks. And I have one other question. The clinic that you had in South Portland where you administered 1,080 shots, what was the expectation and what is the capacity for what you can do every day?
Yeah, I shudder to even talk about capacity concerns because, man, our staff are amazing, and they stand up to do whatever happens. And so, yesterday's clinic was a great just showing of that they just stayed there until they finished the number of people who were waiting outside. And again, it's wintertime in Maine. I hate to make anybody wait outside, but at the same time, we know that this needed to be done, and we're grateful that people were upbeat during the entire time. Very grateful for the activity. And so, it's hard for me to put capacity numbers on that. I think you will see that they'll be doing probably about 1,000 a day at each of those clinics, but only time will tell. Similarly, in Bangor, we have increased the number of appointments for this week and for next week in anticipation of a demand, and so that we can try to meet that demand.
All right, thanks, Patty, for your questions. Next, we have Bangor Daily News. David, you should be able to unmute now.
Great, thanks. Dr. Jarvis, you kind of answered an aspect of this, but is there any of the hospitals in Northern Light system, are there any kind of unorthodox ways that you're treating patients, whether it be in a hallway or just a way that's outside of the normal circumstances? And has that happened at all throughout the pandemic, either in the Delta variant surge or last winter surge?
Yeah, I won't say that it hasn't happened at all, but it's rare that we've had to be able to do that. We know that the best place for somebody who needs to be hospitalized is in a hospital room, and then of course that room can be anything from a basic medical surgical floor, up to any kind of specialty ICU. And so we strive to make sure that we put the patient in the right location. I think what we're seeing more is patients being boarded in emergency departments, and again, great staff doing the best that they can, but not the proper place for many of these individuals. And so across the entire state, most of our emergency departments now have patients who are boarding, waiting to get to someplace else, whether that be a bed in that particular hospital or being transferred to a hospital for a higher level of care. And I think that's probably a little bit more atypical. I've spoken to a few of our independent hospitals of late, and they're hospitals that may typically have at most 5 inpatients, and they have 8 patients who are boarding in their emergency department, something that's very unusual for them. And so I think that's really where we're seeing things. I don't think it's at the medical centers. I think it's at our smaller hospitals that they're taking care of the patients as best that they can. They need some relief, and the best way that relief can come is to decompress our medical centers so that we can then take those patients who need a higher level of care or a particular procedure that only gets done at medical centers.
Great, and I know Paul's not here today, but I think you should be able. I think this is a question about staffing. Could you talk about efforts to recruit and retain workers amid current staffing issues? And has any of the $146 million sent out by Governor Mills assisted Northern Light in these efforts?
Yeah, so David, I don't have any data on that last question of yours. I'm just not in those kind of discussions in my role, and so I don't have specifics on that. As far as ways that we're trying to both recruit and retain staff, we're doing efforts as best that we can across our health system. As we made it very public recently that Eastern Maine Medical Center had raised the starting hourly rate for our employees to get those critical support staff personnel in place. At the same time, we do recruitment of nursing staff through various agencies. We've been very successful in bringing in international nurses who then we train here on site. We have our own nurse residency program where, again, we assist in that. And so, we just continue to do all of those kind of recruitment efforts in order to try to augment the staff that we have now, who are doing a tremendous job, and then really to give some of them relief. Some of our support staff certainly enjoyed that they had their hourly wage increased, and it just makes them feel appreciated, even more so than me coming on here and saying I can't be any more proud of the staff that we have working across all of Northern Light Health and what they have done during, just unimaginable circumstances. So thank you for the ability to once again thank them personally.
All right. Thanks, David, for your questions. Next, we have AP Patrick. You should be able to unmute now.
Thank you very much, and thank you for doing this.
My pleasure, Patrick.
So, thanks. Over the last several weeks of increased daily caseload, one of the issues that we've heard raised a few times is that part of the problem is lower immunization coverage in rural areas, and Northern Light, of course, serves a lot of the rural areas of Maine. So, do you have the ability to speak to that? Is that part of why we're seeing this surge?
Yeah, there's no doubt about that. Again, as I look at the graphic that we're sharing with you, again, the overwhelming majority of patients that are in our hospitals, and particularly those that are in intensive care and on ventilators, are unvaccinated individuals. When we look out in our communities, even those people who have mild disease, again, it is more in individuals who have not been vaccinated than people who are vaccinated. And unfortunately, then that sets up for spread. As we talked about before, community spread occurs by the amount of virus that sits out in our community. The more people who are unvaccinated who get infected, the more likely they will produce more viral elements, and the more likely those viral elements will then infect people who are vaccinated through breakthrough vaccinations, because unfortunately nothing in this world is 100%. And so because of that, we just continue to see this cycle continue on. We've talked about what it would take to have community immunity or herd immunity, and we really feel that it's going to take 80, 85, maybe even 90% of individuals to be vaccinated, and that's before we see the effects of what Omicron may bring to us. While we don't know everything about that variant, it is becoming clearer each day that it is more transmissible than even the Delta variant. And even if it causes less severe disease, the sheer volume that would cause if it was more transmissible than Delta means we'll have more patients who are sick, which will result in more patients being hospitalized, more patients dying needlessly from this disease. And unfortunately, people unrelated to COVID will unfortunately have bad events, including death, if they cannot get to a place that's the right level of care for them. That's our plea. Everybody needs to take responsibility, not just for themselves, but the people who live with them, the people who surround them, the communities they live in, and the state we love and cherish so much. The best way to do that is to get vaccinated. So thanks for the opportunity.
Patrick, did you have a follow-up question?
Yeah, if you don't mind, I appreciate the response. I'm just wondering, is there anything specific that you think that healthcare providers can do at this point? Because the state has tried everything from hunting passes to milkshakes, and the rates kind of are what they are. They've crept up in part with the inclusion of younger people, but they're not close to the numbers you're talking about, like 85 or 90. They're closer to 70.
And I get that. And of course, everybody who has questions still should reach out to a trusted source, and that typically is their primary care provider. Certainly, we're doing the best we can through media, and we appreciate everything you do to get our message out. I will say that anecdotally, I have spoken to a few people this week alone who have decided to get vaccinated. One in particular was because of fears of what Omicron might bring to them, and another was because they wanted to go to a particular sporting event that they were not allowed to go to because they had not been fully vaccinated, and for them that was what it came down to. I think it's still an individual choice. People have to decide for themselves, what it is that they want to do. But our plea is not just for people to think about themselves, but to think more globally. Think about the other people in your household. Think about it. Do you have somebody who's older who would be at risk? Anybody who's being treated for cancer? Anybody with heart or lung disease? Anyone who's pregnant? Any children who can't yet be vaccinated? Those are the people that we have to protect. And the best way for us to do that is to protect ourselves first by getting vaccinated. That lowers the amount of virus in our communities, therefore less people get sick, frees up hospital beds so we can do the job we're supposed to be doing, not the job we have to be doing.
Thanks, Patrick, for your questions. So it looks like we've gotten to everyone, so we'll plan to end there for today. Thank you all for joining us and helping us get information out as usual. As I mentioned at the beginning, we'll have that high quality video file available this afternoon. If you'd like it, just send us a note in the chat or send us an email. We'll get that over to you as soon as it's ready. A reminder that the COVID-19 graphic that Dr. Jarvis mentioned earlier is available in the chat now. If you aren't able to grab it before you go, just follow up with me after and I can get that over to you. And thanks again for joining us today. Any final words, Dr. Jarvis?
Yeah, we're heading into the height of our holiday season, and I wish everyone the best, to be well, to stay safe. Nobody wants to celebrate the holidays in a hospital setting, and so we need to do everything we can, and we need to thank our workers who are working tirelessly in healthcare, as first responders, and these new National Guard members who are being called up to assist us. So I want to say thank you to all of them. Happy holidays, and please be safe.